All right, everybody. So we are talking about hair loss today and hair thinning and how to reclaim your roots. So that is the name of our presentation: Reclaim Your Roots: Proven Solutions for Female Hair Loss Without Surgery. 50% of women have hair thinning by the age of 50. Now, this can be due to menopause for sure. As you get older, you start to have hormonal issues. You lose testosterone, which revs up the metabolism. Your thyroid levels start to go down, and hair will start to thin and fall out from loss of thyroid. But there's also the phenomenon of post-COVID exposure. So whether you were exposed to COVID or you got the vaccination, they have found that hair thinning and hair loss has been a major side effect of that disease process. So again, whether you were exposed or vaccinated, you may be experiencing hair thinning at a more rapid rate. So women are devastated by hair loss, and rightfully so, right? They feel ignored by the media, by industry, because there's just been a lack of options, and they tend not to be taken seriously. And most of the time, they're not taken seriously because hair loss doesn't become clinically relevant until more than 50% of your hair is lost. But you, working with your hair every day, you know the difference between a little bit of hair coming out and a lot of hair coming out. And when you feel a lot of hair coming out and you want to be proactive and do something about it, then you go to your provider and they're just like, "Oh, you look fine," and they mean well, and they're trying to be reassuring, but it's not helpful because you know that it's going down a path, and you don't want to be in that position where you've lost 50% of your hair and finally have somebody validate, "Yeah, look at that, you are losing hair." You don't need that. So what you want are solutions prior to when you lose 50% of your hair and somebody can actually validate what you're saying. You want to hit this off, nip it in the bud. So what women say about hair loss, hair is deeply ingrained in our identity. So they'll say, "I feel like I've lost my identity." One woman said, "I used to be upset by a bad hair day, and now I would kill for enough hair to have a bad hair day." And another woman going through chemotherapy said, "The devastation of losing my hair was much greater than the devastation of losing my breast to cancer." That's a really, really powerful statement. And I worked in neurosurgery for years, and I remember we had to cut people's hair prior to surgery to place little foam sticky things on their head so they could get an MRI. And the women would be devastated by this, and the surgeons never quite got it. They're like, "It's just hair, it'll grow back." But that is exactly the sentiment that is very dismissive and that people don't understand when it comes to women and hair. So our goal here today is to talk about some hair loss, types of hair loss. We're going to talk about a hair assessment. We will talk about treatment options, real life outcomes, and expectations. A lot of times you'll see hair commercials, and it's a woman that's got a ridiculous amount of hair. And is that something that you can actually expect from a hair loss treatment? And then, of course, what everybody wants to know is, how much is this going to cost, right? So that's what we're discussing today, and we'll share what we know about hair loss and your options to treat it. Just to introduce myself, I'm Catie Harris. I am the owner and provider at Philly Wellness Center. And this is my store that we opened in January of 2024 and invested a lot of money in to address hair loss. So we work with a lot of menopausal women for hormone therapy, anti-aging, weight loss, that kind of stuff. And when you're dealing in menopause, weight loss, even long COVID, we do treat. What we've seen is hair loss. So I didn't initially open Philly Wellness Center to deal with hair loss, but it's such a prevalent problem that we had to do something about it for our clients. So we treat men, women, and kids over the age of 13 who have hair loss. So why do we invest so much? Like I said, hair loss is a significant issue in menopause due to the inflammatory process. So hair loss starts with inflammation. You have massive scalp inflammation that destroys the follicles, and that's when hair loss starts. Autoimmune conditions, these become more prevalent in older age as we have fewer micronutrients that we're able to utilize. Our hormones are decreasing precipitously, so we get some autoimmune conditions. And that hair loss due to autoimmune conditions is reversible. And I have a couple pictures where the person is completely bald and then has a head of hair. And so that is only possible if the follicles are still they're still alive, they're still active. Now, if somebody has been bald for like 20 years or even 5 years, there's not a whole lot that can be done at that point. Those patients we do refer to for hair transplant if they need it. But if the follicles are alive, they're just not growing, that's something that we can work with. And that's part of the hair assessment that we do prior to treatment. So hair is critical to a person's self-identity and self-worth, and it's a relatively easy problem to solve if your hair follicles are alive. Now, I want to show you what we can do about hair loss and how we can help you. So what we'll cover are the types of hair loss, the assessment, the outcomes, and the cost. So the Ludwig classification scale, this is female pattern baldness. This is typically what happens, and we see this a lot in autoimmune conditions. So you can see in the first box, you have the part down the middle, and it's starting to get a little bit wide. You can see the white space. And as the scale increases, that white space becomes wider and wider and wider. That's how women go bald. Men go bald in different patterns that might start on the crown of their head or at the forehead, but this is generally the pattern that women see from the midline out, and then they start getting these bald spots that become bigger and bigger. So now there's two different categories of hair loss. You have non-scarring, and then you have scarring. And the non-scarring is, this is your androgenic alopecia, telogen effluvium, and alopecia areata, the traction alopecia. These are different hair conditions, right, that can actually be treated if we can get to them quickly. If we can't get to them quickly, what ends up happening is a lot of them will turn into into the scarring type of hair loss, and that is where the follicle is beyond our ability to effectively get treatment. You might get some ability to treat this, but it becomes less and less able. So scarring alopecia has fewer options. It's just harder to treat, and overall we'll see less dramatic improvements, because when the follicle's dead, it's dead, and there's nothing that will stimulate life back into a dead follicle. So I mean, how do we know if a follicle is dead or not? In the scalp, there'll be some visible scarring, or the area will be completely shiny, smooth on the scalp. In such cases, follicles, typically the scalp is replaced by that scar tissue, and that's how it's irreversible damage. We're unable to help at that point. So if no hair growth, no hair is grown from a follicle for an extended period of time, usually about a year or more, especially in areas of thinning or baldness, the follicle may be inactive or dead. If there's no hair shedding, healthy hair follicles go through a cycle of shedding and regrowth. And if hair sheds, but it doesn't grow back over time, it may signal that that follicle is no longer functioning. And if you notice chronic redness, scaling, or pain around the follicle areas, it could indicate an underlying condition like scarring alopecia, where the follicles are being destroyed. So a dermatologist or a trichologist use specialized tools like a scalp biopsy or dermatoscope, sorry. And we use a form of a dermatoscope with us. Most dermatologists, have moved away from scalp biopsy. It's really not necessary. It's a little overkill. All right. So the different stages here. So this is androgenic alopecia. It's characterized by that widening part that we just saw in the Ludwig classification, and it has a preservation of the frontal hairline. Now, men typically lose that frontal hairline, but in this pattern, this is what happens. So if you see this happening to yourself, there is a lot that we can do with this. So it may also be associated with an underlying itch or inflammation, and it's most commonly present in family history. And you can see the progression of how this gets worse and worse and how this could be quite devastating. Now, telogen effluvium, this is a big one. This is caused by a disruption in the hair growth cycle, leading to an abnormal number of hairs entering the resting phase. That's the telogen phase, and then it starts to shed. There's a lot of triggers for telogen effluvium, and they include stress. So stress, both physical and emotional stress, such as surgery, trauma, psychological stress, career stress, whatever it is, can cause shock to the hair follicles in that telogen phase. And that's when a woman might start brushing her hair, and all of a sudden, just like you see in this brush here, tons and tons of hair is coming out. Hormonal changes, events like childbirth, menopause, discontinuing birth controls, these can lead to hormone fluctuations that trigger hair shedding. Now, we do see this when we start giving women testosterone. They go through a phase of telogen effluvium. So what happens is the testosterone starts revving up the metabolism. And what happens is those hair follicles that have just been hanging out, they start coming out. But we always like to reassure the women that what's happening is the testosterone is generating new, healthier, fuller hair follicles to come out. So, maybe around month 3 or 4, they start getting this telogen effluvium, and it's always disconcerting, but, we've never had anybody go bald starting testosterone. It's new hair coming in, and your hairdresser can rest assured can help you through that, because they'll be able to see the new follicles coming in. Now, nutritional deficiencies will do this too. If you're not getting a proper amount of iron, protein, vitamins like D and B12, this can weaken the hair follicles and cause increased shedding. Nutritional deficiencies is a huge one. And this is one of the first go-tos that we like to look at is, what are your nutrient deficiencies? We can do micronutrient testing to find out. And this is an easy fix. Like if you just need an iron infusion, or you just need protein, or you just need vitamin replacement, that's way easier and less expensive than going through an entire hair restoration protocol. Severe infections, high fevers, stuff like COVID, they can chronic conditions like thyroid imbalances can also trigger telogen effluvium. Medications, including antidepressants, beta blockers, and chemotherapy, cause hair loss as a side effect. And drastic weight loss. So rapid weight loss, crash diets, even the semaglutide and tirzepatide, if you're on those, if you've lost a lot of weight and you've done severe caloric restriction, you're not getting the nutrients that you need. This happens frequently in anorexia, right? Their hair falls out because they don't have enough nutrients needed for hair growth. And it will lead to temporary shedding. This is something that is really, really important when you are on any type of weight loss program, regardless if it's South Beach diet or Weight Watchers or semaglutide. You have to get your nutrients. You need calories. If you don't have enough calories to support your body's functioning, one of the first things that's going to happen is hair loss. Because it's not fundamental to you existing, right? You don't need your hair to exist, but you do need it for a lot of other reasons. Chronic inflammation or systemic illnesses can also disrupt the hair cycle. This is huge. Chronic inflammation absolutely is a major cause of hair loss. All right. So alopecia, these are autoimmune conditions. So alopecia areata is caused by an autoimmune response in which the body's immune system mistakenly attacks hair follicles, resulting in hair loss. The exact cause is unknown. It's not fully understood, but there are several factors that are believed to contribute, including genetics, environmental triggers such as viral infections, stress, trauma, the autoimmune conditions such as thyroid, vitiligo, rheumatoid arthritis. They have a higher risk of developing alopecia areata. Stress by itself is not the cause, but it will certainly exacerbate it. And inflammation, absolutely, it's the number one thing that our goal in hair restoration is to control inflammation, both locally at the scalp and then systemically. Now, alopecia totalis is a more advanced form of alopecia areata that results in complete hair loss on the scalp. It's also autoimmune. It does spare eyebrows, eyelashes. They may not be affected at all. Whereas with the alopecia universalis, you have total hair loss from the scalp, face, body, including eyebrows, eyelashes, and other body hair. So both of these conditions are chronic, and they can be challenging to treat. With the prognosis, it varies by individual. Hair growth can occur, but it tends to be somewhat unpredictable. So it's worth a trial, especially if this is something that has recently occurred. There's newer options. There's Janus kinase inhibitors that can be used to manage some of these conditions, though results will vary. And I will show you an example of how some of the newer drugs really helped out. Whoops. Sorry, guys. So traction alopecia, this is, it starts as non-scarring, but it becomes scarring over time. There's usually a history of very stressful styling practices, such as tight ponytails, heavy braids, or weaves. This is very common, or more common, in African American populations, where they have those really tight braids, and they have them for years and years. And by the time they're 50, this is what happens. And it's because that weave or the heavy braid has constant tension on the hair follicle, which causes it to be inflamed and eventually can cause this traction alopecia. It's also better to sleep with a satin pillowcase. So a lot of African American women use a silk scarf, but the silk scarf actually rubs against the head and causes even more traction. So if you can switch to a satin pillowcase, it will be better for your hair. Tinea capitis. So this is simply a fungal infection known as scalp ringworm. It's caused by a dermatophyte fungi, which invades the hair shafts. This condition primarily affects children, but it can certainly affect adults. And it's relatively straightforward to treat. It will cause patchy hair loss, some scaling, redness, broken hairs, which we can see under our dermatoscope, itching, and in some cases, a severe inflammation. So getting to this quickly will be very beneficial in resolving your hair loss. All right, so inflammation in general can be caused by menopause. So menopause, also known as inflammopause, causes inflammation everywhere. So it causes it systemically, and it will cause it locally at the scalp, which is why a lot of women in menopause will have hair thinning. Around the age of 50, 55, I start getting calls, and, the hair is coming out, and I've gotten pictures from women who are devastated. And again, it's one of those things where you look at them and you're like, you look fine, but they know better. And it's not going to be clinically relevant or apparent to me until 50% of the hair is gone. So why wait for that to happen? They feel it, they sense it, they know it. So let's treat it. Obesity and visceral fat causes inflammation throughout the body. So visceral fat is, fat around the organs. So if you are overweight, then you have visceral fat around your livers. It can be in your muscle fibers, around your pancreas, your stomach. Visceral fat can go anywhere and everywhere, and it causes a release of cytokines that are inflammatory. So the whole body is under constant chronic inflammation. And that absolutely can affect the scalp. And plus, not having the right nutrients on top of it compounds the issue. COVID is basically hyperinflammation in the entire body. So one of the things that we need to do, if you've had COVID, you've experienced hair loss after COVID, we need to control for the inflammation, both locally and systemically. So this is something that's really, really important. We do treat long COVID, and our protocol is basically focused on reducing inflammation throughout the body. Okay, so this one, Trichotillomania is a psychological condition characterized by a compulsive urge to pull one's hair out, leading to noticeable hair loss. It is classified as a type of obsessive compulsive and related disorder and can affect individuals at any age. Why people do it is not understood. There's emotional triggers such as stress, anxiety, frustration. These can prompt hair pulling behavior. And it can also be related to abnormalities in the brain. So it is something that it has an incredible emotional impact. It's coupled with shame and embarrassment, anxiety and depression. So it can be diagnosed on clinical history and interview. And this will require some psychological intervention as well, because there's no point in regrowing hair if the psychological issues aren't dealt with on top of it. So this is something that we can absolutely work with, but in conjunction with some sort of therapy. All right, so now this is where we start this scarring alopecias. So this is a frontal fibrosing alopecia. So you have loss of eyebrows, progressive alopecia in the headband distribution. You'll see the prominence of the frontal veins and the perifollicular erythema and scale. This tends to get more difficult to treat. This is another one. This is called lichen planopilaris. This does become scarring alopecia. So you have that classic footprints in the snow appearance. This is related to an autoimmune condition. And early on, we can help with this. It gets progressively more difficult and your results are less impressive as time goes on and this is not treated. Discoid lupus, it's a scarring alopecia. So discoid lupus is a chronic autoimmune condition that primarily affects the skin, especially on the scalp, face, and neck. And it's a form of cutaneous lupus that can lead to permanent scarring and hair loss when it involves the scalp. Unlike systemic lupus, discoid lupus does not usually affect internal organs, but can still cause significant skin damage if untreated, and clearly affects the hair. So this is something that we would treat also with anti-inflammatories and as well as hair restoration. So this is a scarring alopecia, CCCA. Scarring alopecia, most commonly seen again in women who have African-American women who use relaxers, hot comb use, excessive heat styling practices, and there can also be a genetic predisposition to this. All right, so causes of hair loss, they can be genetics, although I would say that genetics tend to be overblown in how much they contribute to any condition. They haven't really panned out the way we wanted them to. We wanted genetics to say, oh, there's a mutation, let's fix the mutation, then everything's fine. But it's really about the expression of the gene, and it's largely influenced by outside forces, such as your environment, what you eat, those kind of things, your hormones, all the other things that are on here. So we look at hormone issues. We replace thyroid if your thyroid is low. Stress is going to cause if you're under severe stress, hair loss is probably only one manifestation of what's going on in your life. And so getting stress under control will help mitigate all of the issues that are occurring from excess stress. Childbirth, because you have a change in hormones. So this generally tends to be temporary, but we can absolutely support you through that with our solutions. Scalp inflammation, absolutely huge. Crash dieting, iron deficiency. We found women with levels less than 80 tend to have hair loss, and women who have an iron level above 80 don't. So that's an easy fix as well. Low vitamin D levels and zinc levels, so important to test these levels, do some micronutrient testing. Elevated DHT levels can lead to the androgenetic alopecia, and that's something that we can measure with a Dutch test. Styling practices, autoimmune conditions, PCOS, which is polycystic ovarian syndrome, also falls under autoimmune diseases, and COVID. So these are your main reasons that something in here or a combination is what is causing hair loss for you. So one of the first things we like to do is go through and do an evaluation. So a thorough history is crucial. What is your family history? Do you go to family reunions and you can see what happens down the line because your mom and your mom's mom and your mom's mom's mom had the same issues. Styling practices. So are you using chemicals, perms, relaxers, coloring, heat exposure, flat iron, blow drying? All this stuff causes tension on the hair. Do you have itching, dandruff, inflammation? Are you vegan, low carb? Are you iron deficient? High sugars can contribute to yeast that can cause the tinea capitis. And you can have tinea capitis in a way less dramatic form. Yeast infections, sometimes you might feel like kind of this running back and forth on the top of your head, and that generally is a yeast infection. And if you have a diet high in sugars, that is just feeding the yeast. It loves sugar. It's eating it up, and it's getting more and more powerful, let's say. Do you have heavy menstrual periods? If you have heavy menstrual periods, you might be losing a lot of blood during that time, which can contribute to hair loss due to the lack of iron. And menopause, it will be hormone issues. Go ahead. Other questions. Clearly, have you recently given birth, had surgery, had major stressors? What are your energy levels? If you have low energy levels and weight gain, there's probably a thyroid component to this. If you're not sleeping, you're stressed out. Your stress levels might be quite high. Do you have body hair on other parts of your body? So on exam, what we do is a hair pull test. So generally, if you pull 10 hairs, you maybe get one. You want to have less than 3. Over 3, if you pull 10 hairs and 3 of them come out, that's over 30% significance on a hair pull test, which is significant for an issue that needs to be addressed. Well, we examine the entire scalp. We're looking for erythema, scale, pustules, or signs of inflammation and infection. We do check for cervical lymphadenopathy, which can also suggest any type of infection that might be affecting goiter, for thyroid, and looking at hair loss patterns. Do you have the frontal hairline distribution? Do you have preservation of the frontal hairline? Do you have vertex thinning that would be up at the top, and patches of hair loss in different areas? So for labs, generally, it's good practice to start off with looking at a CBC. The CBC gives us general information about how your immune system is working. Ferritin is your iron levels. So if your iron levels are less than 80, usually an iron transfusion will help with hair loss. We do an extensive workup of the thyroid. Typically, your provider, if you've ever gotten thyroid, you just got a TSH and free T4, T4. But we really like to look at FT3, which is free T3 and your TPO and antithyroid antibodies, and treat those as needed. Your DHEA is a pro-hormone, and pregnenolone is the hormone before DHEA. So we like to test those and make sure they're within, because the DHEA in particular is a marker of inflammation. If you have a low DHEA, you have a high level of inflammation. Typically, women in menopause are going to have a lower DHEA. So replacing testosterone actually helps. But if they don't want to do testosterone therapy, then we can do DHEA replacement. It'll break down into testosterone anyway, but it's really helpful. And then vitamin D, we like to keep over 50. Most people that I see have vitamin D levels in the 20s and 30s, and that's really not great. Ideally, actually, in my clinic, 50 is the minimum, but we like to shoot for over 70 on vitamin D, and that can be surprisingly difficult. Now, we do a hair analysis when you come in. This is part of our routine. This gives us a really even closer look at the hair quality and density, so we can see if there's breakage, if the follicles are viable, if there's inflammation. We get a really good look at it. Basically what do you need and how much you need is determined by your assessment and the evaluation, and we do that on site at the Philly Wellness Center. So, in terms of outcomes, we we have a system that I will share with you, but one of the effects that we have is where we're going for anti-inflammation and we're looking for the stimulatory effect. We use exosomes, plant-based exosomes, and what they've found is that these plant-based exosomes increase collagen, elastin production, and secretion of hyaluronic acid. You have 61% daily reduction in inflammation per application, 891% increase in elastin, collagen, and in hyaluronic acid, which is great for hair and for follicle stimulation. So these are just some of the results that we've been able to get with our hair restoration system, the system that we use. So you can see she had that vertex thinning, and after this is about 4 or 5 months of doing hair restoration, that not only has it slowed down and reversed, it's filled up quite nicely here. On here you can see this is another one of those cases that you might look at somebody and say, oh, you're fine, but she can tell the difference, right? And you can see the scalp, much more the scalp in this picture than you can in this picture. In this picture, the hair is much thicker and fuller, and it's much harder to see the scalp on the picture on the right. Now here you have, this looks like a form of autoimmune condition where you have the patchy loss and then the thinning vertex. So on the picture on the right, you can see clearly that patch is growing in, and this definitely takes time. This is at about 3 months. And the vertex has filled in so that she no longer has thinning of the vertex, which is ideal. In this case, again, we have midline vertex thinning. And in the picture on the right, that hair has filled in quite dramatically. Now, this is one of those dramatic results where we talked about the alopecia totalis, alopecia universalis. If it's caught early and the follicles are still alive, this is the type of results you can get. Now, typically on this patient on the left, this person's been like this for years. The chances of this happening on the right are essentially zero. You would need a hair transplant. But if this has just recently happened within 6 months to a year, then this result on the right is possible with the right combination of hair restoration and medications. This is a 14-year-old girl, and the same thing. We were able to grow back her hair with the system that we use. This is a pretty dramatic result, this is life-changing. Honestly, like, this is beyond words what this would do for a little girl. Now, this is only possible, again, if the follicles are alive, and we will know that once we do your evaluation. So all outcomes will vary. Your results depend on the severity of hair loss, the cause, and the length of time, and your individual response. And so that's true for any medical condition. There's always outliers. There's always reasons that we may not know about why things work for other people but don't work specifically for a particular person. But in general, the overall outcomes have been incredibly positive and satisfactory. So there's a lot more to this. And so what I want to do is share with you, I told you that we would go over hair loss types and our evaluation. Then we would go over the different results that are possible. And now it's time to talk about how much is this going to cost me. So this is our Radiance Roots program. This will help you to achieve a healthy scalp, healthy hair, and long-lasting results. So this is unlike other programs because we actually have technology that nobody else has. We have a couple of machines that nobody in the state of Pennsylvania has. We're one of the first to have a couple hair restoration technologies that are extremely impressive. I'm very excited about them. It's part of our investment in hair loss. Now, everything begins with a healthy scalp. And so most hair loss begins with inflamed follicles and clogged glands. So we start with our Aquafirm hair facial. So our Aquafirm machine is a medical grade facial, and it's amazing for facials. But we've also found that it's amazing for hair. So what we do is cleanse and detoxify the scalp prior to any hair restoration treatment that we do. So this will reduce inflammation, it cleanses, and it's really kind of fun. Maybe most people might not think this is fun, but to see all the grime and gook that comes out of the scalp once you do a cleaning that we do. So when we do that hair facial, and most people are kind of grossed out by it, but I find it really exciting to see it, and it's very, very gratifying. So we typically charge $1,500 for 6 sessions for something like this, and we're going to build up, and I'll explain the final price as we go, but these, if you do them individually, these are the cost of it. So everybody loves our medical grade facial. I love it. Oh my God, it's so amazing. But it offers an amazing scalp detoxification prior to implementing our derived hair care system, which is what we use. So derived hair care is also a very amazing program. So what it is it's an exosome, a plant exosome based formula that's been proven to stimulate hair growth at live hair follicles. Again, we can't help dead hair follicles, but if you have live hair follicles, it helps them come back in fuller, thicker than before at a faster rate. It's a very, very impressive system. It does use the power of exosomes. If you don't know what exosomes are, they are messenger RNA that get infused into the scalp. And basically the role of messenger RNA is to tell the cells what to do. So it's a cell signaling process. So the messenger RNA goes in and says, hey guys, you need to wake up and start growing some hair at this follicle. So it will stimulate hair follicle growth and density. And we use ultrasound as well. So that's part of the Aquafirm medical technology. So what we do is after the scalp cleanse, we infuse the exosomes into the scalp with ultrasound. So we don't actually use needles. This is a needleless system. In the past, people have injected PRP. They've injected all kinds of stuff into the scalp, and it's extremely, extremely painful. But what they found is that if you use the ultrasound, they actually get equal, if not better, results than microneedling or injecting directly into the scalp. So that is really, really exciting because, especially for men, men are they're generally not as strong as women when it comes to pain tolerance. But doing microneedling to the scalp or injecting the scalp is really painful, and people don't like it, and they certainly don't like paying for a painful procedure like that. So ultrasound, the ultrasound technology is a game changer, right? And it feels nice actually when you have exosomes being infused into the scalp with the ultrasound. You're like, you could fall asleep to it. It's really wonderful. So the newest piece of technology that we have in the space is the thulium laser, and that promotes hair growth like anything seen before. So we use this in conjunction with Aquafirm and Derive and the Nuvaderm. It's changing hair restoration forever. So we actually use the laser. I don't even have a picture of it. It's so new. So in this picture, you can see her. She's using the laser on the skin, and our Nuvaderm does work on the skin, but it's working at the hair follicle, and it's just tripling the effect of the Derive and Aquafirm together. So it is the newest technology on the market, and it promotes hair biogenesis, and it's used in conjunction with Derive. This is just the top of the line technology that's out there. Now, there's still the issue of systemic inflammation and in extreme cases of inflammation. So based on labs, we determine how aggressively we need to be. We can inject the peptides directly into the scalp, or a lot of times we'll just have you take pills on an ongoing basis. So the peptides really, really help with systemic inflammation, which reduces and mitigates that inflammation at the scalp. So TB4 Frag Max is one of our most powerful thymic peptides that regulates the immune system and decreases inflammation. So we generally have people take that for about 6 months, but we have many, many different protocols based on your specific history and what's going on and what other drugs or medications that you're on. We want to complement things. We don't want to interact with other things. So we work with you on that. And of course, since hair growth requires time and persistence, we do have post-hair care regimen. So in between visits, basically hair restoration is a minimum of 6 months. So you want to come in once a month for 6 months. And in between those visits, we have daily hair serum that will continue to generate hair at the follicle. So we give that to you as well. So post hair care serums promote hair growth in between sessions, of course. Red light therapy has also been known to help stimulate hair growth at the follicles, and we like to complete our treatments with red light therapy. This is something you can get inexpensively and do it at home. And why not? The red light is amazing. It impacts the mitochondria. It's one of the few things that can break through the membrane of the mitochondria and actually fix the mitochondria. Mitochondria is the powerhouse of your cells. It's what creates energy, and it's just vital. So red light therapy is amazing for that. And again, they have red light helmets, red light mats, red light, whatever you can imagine, little panels, big panels, anything you can imagine, they have a red light therapy for that. All right, so if you were to buy all these things individually, right, the Aquaferm, the Derive for 6 months, Nuvaderm for 6 months, peptides for 6 months, the post-hair care for 6 months, and the red light for 6 months, the total price would be $95.10, which is equivalent to about $15.85, since you need to do this for at least 6 months. But we can absolutely do better than that today, and because you are on this webinar. So one of the things, if you were to do all of these things, Aquaferm, Derive, Nuvaderm, peptides, post-hair care, red light therapy, and this is a really advanced protocol. So this is our most expensive protocol. So I just want to emphasize that your price would be $900 a month, which is, about 40% off the regular price. So you're looking at about $5,400. That is the most expensive. There is nothing else to upsell you or to get you in here and say, oh, you need this and this and this, and now your price is back up to $1,500 a month. This is your worst case scenario, okay? And actually, if you just did the scalp with Aquaferm, even at $1,500, if you pay that up front, we will give you 6 sessions for $1,000. So that is the lowest cost, which is $1,000, which is $1,000 divided by 6. I'm going to do some math here, sorry. 1,000 divided by 6. So your best case scenario is $166. Worst case scenario is $900. And then depending on where you fall in this, you'll be somewhere between $166 to $900 a month. And that's the cost. So, again, I know everybody hates it depends, what your cost is going to be. So I wanted to give you that range at least, so you can budget. If you know you need really advanced hair care, your worst case scenario is $900 a month. If you're somewhere in between, it's going to be less than $900 a month. So it's absolutely worth it. This is the most comprehensive hair loss protocol on the market. Nobody else compares to what we're doing. We can honestly say that because no one has the technology we have. And even if they did, no one would offer this at this price. I've seen some outrageous hair restoration protocol prices, and it's not necessary. We want to be affordable. Hair is so important. It's so vital. And yeah, we don't want to take advantage of that. We want you to get the best hair restoration protocol that you can get at the most affordable price that we can offer it at. We do have Cherry and Care Credit. Both of these have 0% interest. If you pay over 12 months, you do need a credit score of 700 or more in order to qualify for that 0% interest. But that becomes a game changer when you can pay 0% over 12 months and you break up that payment. So now that $5,400, if that were your worst case scenario, now you're looking at $450 a month. I mean, that's pretty amazing as your worst case scenario. So again, if you were to do the complete advanced protocol, we would do Aquaferm, we would do the Derive, we would do the Nuvaderm, you would get peptides for 6 months, you get your post-hair care, and we'll do red light therapy while you're in the office. That worst case scenario would be $900 a month if you apply for Cherry, and you get 0% interest for 12 months. That reduces the price to $450. If you don't need all of these things, then your price will be somewhere less than $900. So very, very excited to share this with you guys because, again, hair care is so powerful. And, we're all so wrapped up in our hair. It identifies us. I know once I started getting white hairs, I was having a panic attack and an identity crisis, and that doesn't even compare to hair loss, losing your hair. That's so devastating. So if this is something of interest to you, click the button below, schedule an appointment with us. Just come in and talk. It's free to come in and talk to us. We pride ourselves on being educators. I'm not here to sell you things that you don't want. If this is something that you want, I wanted to present it so that you know what you're getting into. It's not going to be a surprise. This is what it is, and this is what we can do. So if you're interested, please book an appointment with us. Come in and see us. We'll do your hair analysis, and if you want to move forward, let's do this. All right, guys, it was great to speak to you, and hope to work with you in the future.